Hi, my name is Karish Jones, and I'm a psychiatric mental health nurse practitioner student at Eastern Kentucky University. In this presentation, I will be presenting my evidence-based project proposal. Depression is a major problem both nationally and globally. In 2020, the World Health Organization listed depression as one of the leading causes of disability globally. What was already a severe problem has only worsened during the last year of pandemic. Recent studies demonstrate the prevalence of depression symptoms in the United States tripled during the COVID lockdown. An integrative review was conducted to investigate whether the evidence supports the following PICO questions. For adults diagnosed with depression, how does supplemental cognitive behavioral therapy, or CBT, compare to treatment as usual and reducing depressive symptoms within 3 months? The purpose of this evidence-based project was to utilize the findings of this review and design an intervention treating patients with depression using weekly CBT classes. The theoretical framework used to support this intervention was Barker's Tidal model of mental health recovery. This is a mid-range nursing theory suggesting that life crises are normal occurrences, but sometimes overtake people's lives, leaving them in need of support. The theory emphasizes the importance of exploring clients' experiences from their own point of view, rather than reducing them to a mere diagnosis. The model proposes treatments for mental illness should be self-directed, providing a sense of empowerment. A literature search was conducted using the CINAHL Complete database. The search was limited to peer-reviewed academic journals published within 5 years, studying an adult population only. The first study I used to support the intervention was a systematic review and meta-analysis comparing the effectiveness of CBT delivery modalities. This study was published by Lopez and Lopez et al. In 2019. The review included randomized control trials studying adults with a primary diagnosis of depression who received a CBT intervention. The control groups received treatment as usual. Study results were obtained by comparing a follow-up depression scale to a baseline scale. The results of the study indicated that additional CBT interventions are suitable for the treatment of adult depression over treatment as usual. Next, a clustered RCT by Loebner et al. In 2018 was analyzed. This study was conducted to investigate the effectiveness of additional self-directed, internet-based CBT to treatment as usual for patients with moderate depression. The trial featured a control group made up of participants who only received the standard treatment for depression. Depressive symptoms were assessed using the Beck Depression Inventory and the PHQ-9, or the Patient Health Questionnaire. These were conducted before the onset of treatment, then at 6 weeks and 6 months. The results of the study indicated that the intervention group had a greater reduction in depressive symptoms compared with the control group at 6 weeks, and a significant reduction in depressive symptoms compared with the control group at 6 months. To conclude the literature review, a qualitative study was analyzed. The study's purpose was to explore patients with depression on the perceived advantages and disadvantages of suicidal behavior to guide clinical interventions. A content analysis approach was used to identify common themes from the collected data. The study results indicated that escaping from problems and troubling thoughts, ending pain and suffering, and seeking support were the most commonly perceived advantages of engaging in suicidal behavior. The findings also suggest that the prevention and treatment of suicidal ideation in depressed patients should be focused on improving problem-solving skills and emphasizing the important role that patients play in the lives of their family and friends. The 3 studies examined in the literature review corroborated the World Health Organization's assertion that depression is a significant problem and major contributor to disability. CBT is one of the most studied and effective therapies developed for depression. More than 75% of people treated for depression with this modality show marked improvement, with results lasting long after completion of therapy. By ensuring patients with depression have access to CBT, psychiatric mental health nurse practitioners can achieve the best possible patient outcomes. The next part of this presentation will focus on the proposed implementation of a pilot CBT program to take place in an outpatient mental health practice. The target population includes adults experiencing moderate to severe depression, as evidenced by them achieving a score of 10 or higher on the patient health questionnaire. Even though the implementation of this project is not considered research, the ethical principles of beneficence, non-maleficence, autonomy, justice, and fidelity will be adhered to. In accordance with the ethical principles of the Universal Declaration on Bioethics and Human Rights, informed consent will be obtained from each participant. Adequate information related to the project will be provided, and participants will be informed that they may withdraw at any time for any reason without facing recourse. Clients will be screened for depression using the PHQ-9 screening tool. According to the University of Washington, the PHQ-9 is one of the most validated tools in mental health, an ideal tool to assist providers with diagnosing depression and assessing improvements in treatment. The process will begin with selecting the appropriate team members. The team will be made up of a psychiatric mental health nurse practitioner, a psychiatrist, and a licensed therapist to instruct the CBT course. Initial funding for startup costs will be secured from community grants. Clients will also be billed for services provided. A sliding scale payment option will be made available to clients who are uninsured or who are suffering from financial hardships. A location will be identified and times for the weekly groups will be determined. The meeting place will need to be large enough to accommodate the participants comfortably. Adults over the age of 18 diagnosed with severe to moderate depression will be identified and recruited to participate in the project. At the time of recruitment, the clinician will explain the supporting evidence and potential benefits of the intervention. If the client agrees to participation, the clinician will provide a schedule of the therapy sessions and schedule for follow-up appointments. The entire program will be 12 weeks in length from the initial evaluation to the final assessment. At the conclusion of the 12 weeks, the clinician will obtain the final PHQ-9 from the client and note any reduction in score, which would indicate a positive outcome related to the CBT intervention. At the end of the CBT course, a team meeting will be held to synthesize and draw conclusions from the findings. A presentation summarizing the cost, implementation process, and results, with any critiques on how the program could be improved, will be presented to stakeholders within 3 weeks post the final evaluation. If the outcomes after completion are positive, the program will be expanded to more clients and continued. The on-staff therapist will then offer more group sessions. An additional therapist may be brought on to support the patient volume. If the project yields a significant positive outcome, the findings will be disseminated through publication in relevant professional journals, as well as made available to local news. This evidence-based project proposal aims to take the findings supported by literature and translate them into clinical practice to include outcomes. Thank you for watching my presentation. Have a great day.